So now we're going to move on to the shoulder anatomy and physiology. And so the first thing we're going to do is we're going to look at the shoulder and the parts of the shoulder. And then we're going to look at the motions, the range of motions in the shoulder. So let's go ahead and get started. So as it says here, the shoulder joint is frequently injured due to having so much mobility to move. So it's probably one of the two most movable joints in the body, the other one being the hip. I think you actually have more motion in your shoulder than you do in your hip. So let's take a look at the shoulder joint. And as you'll notice here, the shoulder joint is made up of the head of the humerus and the scapula, and it's a ball and socket joint. So let's go ahead and take a look at this. Okay, so here's the parts of the shoulder joint. If you remember, when we talked about the clavicle, we said that the clavicle and something called the scapula make up the AC joint. So here's my AC joint again right here. This is the scapula. You guys know the scapula as your shoulder blade. And this is it right here. Okay, and then this is the humerus. This is the top, this is your arm bone right here. And if you'll notice, the humerus comes up and it's kind of round right here. And that's why they call this a ball and socket joint, because of the fact that this is round and it fits into this area that's over in here. So those are the three bones that are going to make up our shoulder joint: the humerus, the scapula, and the clavicle. Some people call it the shoulder girdle because of the fact that the clavicle comes out and then you have the scapula behind it with the rib cage right here. Here's another view of why they call it the ball and socket. You can see you have some cartilage on the top here, and this is called the glenoid here. And so, like we said before, this is like a ball, and then this would be the socket part. This is actually pretty flat right here. And again, this is my scapula right here. This is my collarbone, not my collarbone, my shoulder blade. That's right here. And then this is the humerus, which is the arm bone. And this is, again, why they call it a ball and socket joint. Okay, so like we said, it's a ball and socket joint. The humerus, that's the arm bone, articulates, means it forms a joint with the glenoid cavity of the scapula. So we're going to look a little bit at the glenoid cavity in just a minute, but before we do, the glenoid labrum is a fibrocartilage that surrounds the glenoid cavity and deepens the joint. So the surface of the scapula is flat, and then this is just a soft tissue that surrounds it to make the joint a little deeper. So let's take a look at that. So if we take a look at this, you can see how flat the glenoid cavity is here. And again, the head of the humerus, the arm bone, is going to be the round circle that fits into this. And then because this is so flat, your glenoid labrum is actually going to be a soft tissue, and I can't draw, but it's going to be a soft tissue that goes around this, that kind of surrounds the top of the head of the humerus also, to make to make this joint deeper, to make the glenoid cavity deeper. Okay, and this is look at the same view again. Here's my glenoid cavity. I know it's hard to read this, but here's my glenoid cavity again, and it's nice and flat over here. But here it is looking straight on without the glenoid labrum. So this is the part that the scapula, or that the head of the humerus, is going to fit into. Here it is again. You can see the flatness of it over here. So that's my glenoid cavity. Okay, and so this is looking at the glenoid cavity again. This is it here. And then you can see it says labrum. This is my glenoid labrum that's going around here. You can see they say there's a tear up here, which we'll get into in a little bit. But you can see how it's surrounding it, and it makes the joint actually a little bit deeper. So that way when the head of the humerus goes into there, it helps hold it in place. And then if you also notice, it says joint capsule. So once the head of the humerus is in here, you have this joint capsule, which is ligaments that are going to surround this. And now you're looking at the joint capsule. So like I said, the joint capsule is ligaments that surround all this. And you can see the ligaments that are in here. You can see down here it says joint capsule, superior, middle, and inferior glenohumeral ligaments. That's them right there. You don't need to know the name of those. I'm just showing you the ligaments that are surrounding the head of the humerus or your arm bone. They help hold it in place on your shoulder. So it can allow for a lot of range of motion, but this still keeps it in place. So now we're going to look at the ranges of motion that you can do with the shoulder joint. Like we said, it's a ball and socket joint. Circumduction is movement in a circle. Abduction is when you move the arm away from the body, or you could say the shoulder. Adduction is when you move it towards the body. Medial and lateral rotation of the arm also takes place. And then flexion and extension of the arm. So let's go ahead and take a look at those. Okay, so this might be a little hard to see, but this is adduction. So adduction is if you're standing straight forward and you raise your arm straight to the side. So here's the arm, and we raise it straight to the side. And this could go up higher than this. If you can go all the way above your head, that's fine. But that's adduction. Abduction. Adduction is going to be if you bring your arm back down, you're adding it to your body. And if you also go across the other way, that's all adduction. You can see over here too, they're talking about horizontal adduction. So let's say you're standing, all right, to give you an idea of what we're looking at here. You're standing, and here's one arm. Let's just say it's down by your side. This arm is sticking out to the side. So now this view here, as if you're looking down like this. So you can see in horizontal adduction, adduction, we are going to go around this way. Okay, and if you were to go back this way even further, that's going to be abduction. So adduction, I'm going to be bringing it this way, right? I'm adding it to the body. A, D, D. This is adduction, and then this way, coming back this way, is abduction. All right, and that's abduction to go this way. If you also look, we're going to do flexion. So imagine you're just standing straight up and you bring your arm up like this, and that's flexion. And again, we can go all the way up to the top of the head. And you could actually say flexion is a form of abduction, right? Coming back, extension would be anything that's going to be coming back this way and going back this way. Whoop. Okay, so this is my abduction. I'm sorry, this is my flexion. I'm still sorry, this is extension. Going back this way is extension. Flexion, extension. And then if you look here, we're going to get internal and external rotation. So what's happening here is this guy is standing with his arm bent, going straight out in front of him. And if he goes this way, what happens is the shoulder has to also rotate this way to rotate the arm out this way. You don't have to have your arm bent to do this. A simple way to do this is if you have your arms by your side and they're face up, your palms are facing forward, and then you turn them so your palms are facing backwards, you're actually doing internal rotation. External rotation would be as if your arms are, as if you're standing straight up and your palms are facing backwards, and then you turn your palms forward so they're facing in the same direction as your face. That's going to be external rotation, because to do that, To do that, if my palms are facing towards my back, right, I'm going to have to go this way. So that'd be internal rotation. I think I just said external rotation, so I might have gotten those backwards. External rotation, I'm moving this way. So my arm has to turn this way. Internal rotation, I'm bringing it forward. Okay, and as you can see, you can also just do this if you have your arms sticking straight out. So I can have my elbow down by my side and do internal and external rotation, or I can have my arm at a 90-degree angle to my body and do internal and external rotation. Once again, if we're doing external rotation, you'd be going up this way, internal rotation, going down that way. And the last one is going to be circumduction. Let me erase this. And in circumduction, what's going to happen is you're going to make a circle with your shoulder. You can make a circle with it, and that's circumduction.